My name is Dr. Salil Jain. I am Director and Head of the Department of Nephrology and Kidney Transplant at Fortis Memorial Research Institute, Gurugram. My colleague, Dr. Vishal Saxena.
Hello, I'm Vishal Saxena. I'm an Additional Director at Fortis Memorial Research Institute, Gurugram, and we both are kidney specialists.
We take care of dialysis and kidney transplantation at our institute, providing the best care. Regarding patient Keron, one of my common friend at British Guyana, he's a doctor there, Dr. Tembe, he told me that he has a patient there who has a chronic kidney disease and is requiring dialysis with severe back pain and is in need of kidney transplantation also. And I suggested him that it would be a good thing if he can send this patient to us and we can take good care of him. And subsequently, the patient wife, sister and the mother, they contacted me over the phone regarding his condition, and we actually told them that they can come over and we can provide them the care that he requires. Once Keron came here, we actually saw him and he was in too much of pain. He was not able to walk properly and looked very weak. We tried to initially diagnose why he is having the back pain and had to assess him for these spine issues. We found that he has most likely a tuberculosis of the spine, and we treated that first, and later on, after treating this tuberculosis of the spine, we did a kidney transplantation with his mother as donor. The operation went well and everything is fine now, and Keron, as you can see, he is now fit and smiling. He is able to walk and ready to, actually he can actually walk back to his British Guyana if there was a land route. So I would appreciate if they can tell about their experience here.
Well,
Give your introduction that you are.
yeah, I'm Keron's mom, and I'm the donor. I decided I make up my mind to do it because I realized that I was losing my son, and I had to step in and I had to step in and save him. He's a loving child. He's the best son a mother could ask for. He likes food. Yeah, he likes nice food. He likes to go fancy places. He's not a drinker or a smoker, but he's very nice. So when he got sick, it really broke my heart. But thanks to Dr. Timby to putting us on to Dr. Salil. The team work here was great. We are grateful, and I must say thank you guys for taking care of my son and giving me my son back. He's doing well now. He's doing well. You all have a good program going on. And my experience here is great because imagine he came in a wheelchair and within weeks he was walking. And before the surgery he was walking a little bend. And after the surgery he's walking straight. Yeah, so I would advise anybody or tell anybody about here. He has the best medical teamwork. Thank you, Dr. Vishal. Thanks, everybody.
So, Keron's sister is a registered nurse at British Guyana, and she has been taking care of him at British Guyana. And what she has to say about our nursing and the care that we have given to Keron.
Well, I'm amazed at the hospital journey. Let me start at that. The hospital is vast different from mine back home. There is a variety of medical care, programs, departments, specialists. I'm impressed. The nursing care and doctor care as well, and interest was very good for my brother. I'm grateful that they helped to bring him back out of that critical stage that he was in prior to coming here.
Keron, would you
Do
like
you
to
want
share
to
your
say
thoughts
something?
regarding your experience at Fortis Gurugram?
Well, I'm just grateful for the care that was given to me. We were nervous traveling this far from home. We don't know anybody, right? We are from Guyana in South America. We're coming here in India. Nobody, we know no one. And our family is already small. But when we came here, the first day that we came here to Fortis Hospital, the good thing about it was is that I was in the wheelchair. My mother and my sister were waiting at the dialysis center. We don't know where to go. And Dr. Salim just shows up and say, "Hi, I'm Dr. Timbe's friend, Dr. Salim." And that's very uncommon.
That was a relief. We feel so good when you said
Right.
that because we felt alone. Yeah,
Right.
that was
and
a
that
great
just
thing.
made the day perfect
Yeah.
as day one.
Yes.
Right? So since then, he has made everybody comfortable, especially my mother and my sister. Right? I have been comfortable, and it's just been a relief being here under your care, the care team, the nephrology team. Right? And yes, I would recommend anybody to come here. Right? I don't think, personally, I think a lot of people have said that even the U.S. might have not done as good a job as you guys. Right?
Yeah, the amount of tests that you guys done, that makes the difference. Because even back home, they wouldn't have done so many tests. You know, they just go maybe a couple, and they just go straight into the surgery. We could have done it at home, but we didn't want to do it because we didn't like that system. You know, where we come here, the amount of tests you guys run, and so, you know, we felt comfortable. Okay, he's going to live. They know what they're doing, and their experience, years of experience. So my daughter look up on the internet about you guys and see that the amount of years and the experience you all have, you know. So it was a good name, and we felt comfortable with the whole team. Yeah.
Thank you for the appreciation and showing such faith in us
Yeah.
without actually being interacting with us and coming from so far. And I'm happy that we actually did the job as per your satisfaction, and we do look forward to have long-term relations with
Yeah.
you. And if you have any issues later on, we are always available over the phone, over the mails. And if you have other patients who need such kind of treatment,
We
you
will
can-
direct them to-
yeah, we will definitely take care of them like
Yes.
what we have done here. And all the best to you.
Yeah, thank you. We will keep in touch. Even from a distance, you still remain, or you guys will still remain our doctors. You know, any kind of query or whatever, we will call and contact you guys.
Yeah.
So I think that fulfills our purpose. Kidney care for everyone and everywhere.
Yes.
So that's the motto of World Kidney Day this year.
Yes.
And that's what we feel, that medical science has no boundaries.
Yes.
And I think you guys are the living example of this thing.
Yes.
You came from far off, you got yourself well, and you're going back well. So all the
Yes,
best.
yes. So thank you.
Bye.
Thank you. Yeah.